Well, there needs to be a better communication between the patient and the physician, but it should be an informed physician, let's say. And this physician, the other level we didn't discuss so far about it was, do we need specialists in allergy treating these patients? For example, in Germany, we have a 2-year, or if you have done internal medicine, pediatrics, a 1-year additional education to treat allergic diseases, not just allergic rhinitis, but also other diseases, allergic disease. This, I think, is a good approach, which enables at least some people, maybe 1,000 in Germany, 1,500 in Germany, to really know more than the average about this disease. The question is, should only these patients then see these doctors see the patients? And I think for allergic rhinitis this is impossible because it's just too many patients. So we need to increase the communication and the feedback. And so far, if you go to see your doctor once a year or once every 2 years, that obviously doesn't work. You need another system. And it would be really good to think about several systems. One is, for example, as Jean Bousquet talked about, apps, other ways. But there need to be a feedback system also from the doctor. So it needs to be of value for the patient and for the doctor. So only then, I think, you can increase the communication, at least between these two. Then we still need a better communication from, the specialists about immunotherapy with the physicians. And there's a lot of change in the last years. We came from looking at immunotherapy as one bag to looking into specific products, understanding that they're not all the same. Not that we don't have evidence for some, but in the meantime, we have negative evidence for some of the products that have been still distributed to the population as a therapy. This has to be stopped, of course, but there needs to be education to the physician of what to take in what situation. And nowadays, this is quite easy, actually, for the patient. In the former time, immunotherapy was dangerous. From time to time, someone was dying from an injection. Nowadays, for example, we have tablets. The risk is much, much, much less. The risk management is much easier. But that has still to be understood from the patient side and from the physician side. So again, there needs to be more interaction between patient and physician. And I think that is something where internet, the modern communication ways, plays an enormous role. I wouldn't know how to do it differently. But of course, for doctors, it means that they don't just deal with a patient who comes into the practice. It means that they deal a lot with patients via internet, probably in the evening. They have to sit there, answer emails, see maybe actively how is a patient with the app, how is a patient performing? Oh, that's not good. I have to interfere. So an active approach to the patient. And I think that's only possible with platforms such as apps and internet that make that possible.
Guys, you note?
Well, I think that we are going to the digital transformation now of health. And I do believe that what we say today will not be what will be tomorrow. Because today it's still the physician at the top of the pyramid, and very soon it will be the physician with the patient, but interacting together. So we need to change physicians. We need to change the way we are practicing medicine in a way that will be agreeable to patients, because we do not bring to patients what they want, but we bring to patients what we think is best for them. And it's possibly not exactly what is best for them, because I'm always taking a comparison. If you take an Arab country and if you bring a boat of ham, this country is starving, you bring a boat of ham, you're going to be received by stones. And this is exactly what we are trying to do in most places. Then you say, well, ham was not good enough, so this is education, and you bring the best ham, and you're received again by stones, because you didn't bring to these people what they want, and they are right to welcome you by stones. So we need to change. And my last paper is change management based on a business concept. We need to change the way we are practicing medicine with the digital transformation of health.
Mr. de Boer, question, if we talk about the patient's perspective, from your experiences, what can be done to raise awareness among patients about immunotherapy?
This is really a good one. I can give you an example because I'm so positive about this therapy. And I have a lot of friends in Europe. I talk about it to them myself. Even there are some friends of mine in Italy who are using now the therapy I am using. So it's the word of mouth and it's the publicity I make myself, talking about my past and my present. And I cannot talk for doctors in general, but according to me, when I hear the professor, there was a lack in the past 40 years, in my case, of knowledge by my general practitioner, who didn't know, I think, what is the right medicine. So the result was me trying and discussing a bit, well, this is not working, this is not enough, can I do more? There was not enough knowledge available for him. So I think I can agree they need to be educated in a better way. And next to this, interaction with patients, I'm very happy to hear it because it can help them as well to gain knowledge about real life.
Dr. Canonica?
I think that digital medicine nowadays is something that is really the way to go, as Jean Bousquet was saying. I must confess that I'm a little bit worried, and this is my warning, that we should be very, very careful about the internet because of the fake news. And I think that regulation in this sense is needed, first. Second, the scientific societies at any level, I'm talking about European level as, I would say, regional level. I mean, they should propose in agreement or in partnership, even better, with the patients' organizations, what are the correct educations and the correct news.
Dr. Shamji, your opinions?
So I fully agree with what Professor Canonica and Jean and Claus are saying. I think we need a better communication between the patients and the physician. We need to think about how to maximize digital platforms, and also particularly to think about the in terms of cybersecurity, in terms of dissipating successes. For example, you mentioned that by word of mouth, you let your friends and know that how successful it's been, and some of them are actually now taking. Mm-hmm. So, taking it to Twitter would be really great, for example. But at the same time, one has to be very cautious in terms of fake news and how that could be exploited. So it's very important to think about the relevant measures around it, and then with that, bringing integrated care pathways forward. That would be the way to go forward.
We all do studies, and we see in these studies that the verum, the real drug, is better than placebo. That is what we are used to, and that should be really the first step for all of these drugs. Otherwise, we cannot talk further. For a patient, it's very difficult to figure out what he just experiences in "I'm getting better" is placebo or verum, or most likely a combination of the two. And that is something that is extremely difficult in the internet, for example, to somehow evaluate or control, because everyone who has taken, just an example, have a stamp on the forehead and says, I'm feeling much better. And this news spreads exactly the same as the news about immunotherapy. And we know that this is a placebo effect. So that is extremely difficult, and maybe Jean, you can say something about that. How do you sort out what is good news, real news, and what is possibly fake news, or not even fake, but it's just the perception of a patient without the scientific background? So how do you sort these things out? And that is always difficult for me in terms of communication in internet platforms.
You will never prevent fake news.
Yeah.
And you saw the last election in the US. So it's impossible to prevent fake news.
Yeah.
No one has the possibility, and now I know that there are fake news for everything. So fake news will always exist, and we have to deal with that.
But we need more trustworthy sources then.
Well,
Exactly. Can we sort of
no,
determine
but
trustworthy
we
sources?
are discussing on an ivory tower here. You have millions of patients with rhinitis. They go to the internet. They don't know what they have. I've recently checked the apps because I want to see the competitors what are doing. And there are dozens of apps. Many of them, when you dig with them, are stupid. But how can you prevent this? It's not possible. So we need to come with a different view, not saying that we don't want fake news because we have them. But I don't know, but I think that in Europe, there are people on digital health who try to understand that. But at the end of the day, fake news, like fake papers, the scientific evidence will be completely gone in 5 years. So we cannot prevent this. We have to live with this, and probably we need to bring novel approaches which are not existing today.